Hi, my name is Dr. Justin McCormick, and I'm the Clinic Director of the Chronic Pain Center in Mill Creek, Washington. I have successfully performed thousands of treatments on patients with peripheral neuropathy. I have 10 years of experience in dealing with complex cases of radiating leg pain, tingling, numbness, burning, weakness in the feet, and weakness in the legs. First of all, what does neuropathy mean? Neuro means nerve, and pathy means sickness. So basically, we're talking about a sickness of the nerves. Basically, peripheral neuropathy has two signs that patients present with. They're called positive and negative signs. Now, a positive sign, that's going to be things like electrical pains in the arms or legs. It might be a burning sensation. It could be cramping in the calf muscles or maybe the thighs. It might even be tingling that keeps people up at night. On the other hand, a negative sign, that's going to be things more like your feet go to sleep. You can't feel your toes or your fingers anymore. It might be weakness in your feet, weakness in your hands. But the bottom line is that sick nerves can cause a very sick person. Now, because the symptoms typically occur in the hands and the feet, that's where most doctors look to treat the problem. However, they're usually unsuccessful because there's nothing really wrong with that part of the body. The problem is in the nerves that are going to that area. So the pain and symptoms are coming from the sick nerves. So how does peripheral neuropathy actually start? Now, most of the time, the symptoms are quiet when they begin, and they slowly progress over time. So a patient might have things like diabetes that develops into a diabetic neuropathy. They might have had a traumatic car accident or a work injury that may have started this peripheral neuropathy, and then it slowly got worse over time. Sometimes it's a virus. Sometimes it's genetic that starts peripheral neuropathy. There's even some cases where it's idiopathic neuropathy, which means there's really no reason why the problem started. But again, it slowly progresses over time until the nerves actually degenerate, and at that point, many cases go undetected until they're too late. So the important thing is that we get this problem corrected in the earliest stages possible. So the bottom line is, peripheral neuropathy is a multifaceted, complex, and a very serious problem. It can come from musculoskeletal problems, it can come from neurological problems. And that's why we in our office, we address both of those issues. So what makes us different from different doctors, from different offices? Well, first of all, we use a non-drug approach. Now, I know in the initial stages of symptoms that drugs do help cover the pain. But the problem is they don't fix the issue, and they allow it to get worse over time. I have patients that come in and they say that their doctor just recommended some medications, and they said, see if this works, and if it doesn't, you might just have to learn to live with it. Well, even if the drugs did help with the pain, again, they're not fixing the problem. And most people will start to go back to their day-to-day activities and can actually make that problem worse. The approach that we use addresses the actual cause of the problem. So we're going to treat it neurologically, which is the nerve pain, and we're also going to treat it musculoskeletally, which is the origin of the nerves that actually many times creates this problem. The first thing that we do is evaluate you to find out if you're a good candidate. Okay, we'll do 40 to 50 different tests to find out if you're right for this procedure. Now, we also do things like EMG, which is called electromyography. That tells us if the nerves are sick or if they're healthy. We'll also do MRI, we'll use X-ray if we need to try to find out if there's maybe a spinal problem associated with this. Now, let's assume that you are a good candidate for this procedure. What do we do? Okay, one of the things that we use is called laser therapy. We use a laser protocol called Erconia, which is an FDA-approved device at decreasing inflammation in the nerves, which is causing the nerve pain, and it also facilitates the body to heal at a faster rate. We use what's called spinal decompression, which is the most advanced technology at treating disc problems. And disc problems many times are what will cause that nerve to become sick and develop the symptoms of peripheral neuropathy. We'll use vibration therapy. Vibration therapy is where we place the affected area, whether it's the hands or the feet, and it stimulates that nerve to repair at a much faster rate. Oxygen therapy is another thing that we use. Oxygen is fuel for your body, and so when we use this therapy, it actually helps to stimulate your body and your nervous system to heal at a faster rate. Now, if what I've said interests you and you are actually ready to fix this problem, call my office. Okay, we're going to do a free peripheral neuropathy evaluation to find out if you're a good candidate for the protocol and the procedures that we use. I'm also, assuming that you're a good candidate, going to offer you a free trial visit so that you can experience firsthand what a treatment is like and if it's going to be beneficial to you. You'll also be able to see how all our advanced technology works firsthand. You'll be able to see everything in our office and how it works. Again, if you're interested in this, call my office. It's 425-379-9749. Ask for Samantha, ask for Rebecca. They'll be happy to help you. Again, ask for that free peripheral neuropathy evaluation. And if you're a good candidate, they'll be happy to set you up for that. So just think about for a moment, if you didn't have this tingling, this numbness and burning, what would your life be like? You know, imagine a day without having to worry about numb hands and numb feet and electrical sensation and all these type of things that go along with peripheral neuropathy. I've helped many patients with these problems, and they're now living a normal life. Again, call my office, 425-379-9749. They'll be happy to set you up for that free evaluation. It's going to cost you nothing, and it could help change your life. Thank you very much, and I look forward to seeing you and helping you soon.